treatment is time sensitive. But once it becomes a major stroke, then they rush to the hospital.
Without knowing that he or she actually has a stroke. Is that?
They may be into deep coma. So somebody around has to assess them and know that this is not normal. It may not matter a lot to a patient on the other side because they don't understand the spectrum of the disease.
Ladies and gentlemen, welcome to Story Makers. Today we are going to be talking about something very, very important. My name is Shubhajit Ghosh, your host for today's podcast. And the subject of discussion for today is something which actually a lot of people don't really prioritize, but they actually should. Because it's a very, very important medical term which can literally happen to anyone. There are a lot of myths around it, that maybe this is something that's only related to old people. Maybe this will not happen to me ever because I follow this, I follow that, etc. But all those myths are going to be busted over here because we have with us somebody truly, truly special. She's an expert in her own right. She has done incredibly well in this space. We're talking about stroke today, in depth, what leads to stroke, what are the possible causes, how do we actually cure it, the treatment options. We spoke about myth busting and all that because right now over here we are to do stroke per rogue. Now to do the honors and to do the conversation, we have with us somebody truly, truly special, Dr. Sunanda Anand. She's the Honorable Interventional Neurologist from Holy Family and Nanavati Hospital over here in Mumbai. Ma'am, it's a pleasure to have you. How are you doing?
Good. Thank you for having me.
My pleasure, ma'am. We're talking about stroke. We're talking about different conversations regarding stroke. Unfortunately, I would say that it's a word that everybody has heard, but not many people have tried to kind of delve deep into the subject and understand more about what it is, right? So to get the basics right, in order to make the most of having your expertise over here, may I please ask you what exactly is a stroke in your own layman language?
Okay, so we know stroke. Everybody knows what is a stroke.
Right.
And they confuse it with a heart attack.
Correct.
That's a myth. Now, stroke is a disease of the brain. It's a disease of the blood vessel of the brain. The most common cause of the stroke is because of a blocking of a blood vessel, which leads to the loss of nutrients and oxygen to the area of the brain, and that gets damaged, which we call in common language a brain clot. The next common cause of a brain stroke is because of a rupture of a blood vessel, which can lead to a bleeding in the brain, and we call it in common language a brain hemorrhage. So these are two main causes which causes an ischemic stroke or a hemorrhagic stroke in public at large.
So, of course, given the kind of expertise and knowledge that you have worked in this field for the longest time. So this is pretty much like your day in, day out knowledge stuff, right? But
right.
For the regular, audience, how do they actually identify the early signs of stroke? Because prevention is always better than cure, right? So how do they actually do that?
Okay, I think it's a very good question. So for this, a test called a FAST test was invented many years ago. And this is a community test. This is not for the doctors. It's for people at large to recognize stroke in public so they can get timely intervention. It is important because stroke treatment is time sensitive. Now, the F stands for the face. So if you ask the person to smile and, the face deviates to one side, you should suspect that the person can be having a stroke. A stands for the arm, where, ask the person to lift the arm. If the arm drops or they cannot lift it, so there is weakness of the arm, and you should suspect that the person is having a stroke. S stands for the speech. If I'm talking to you and if I'm not able to speak a few words, or if my speech slurs or it mumbles, then you should suspect that I may be having a stroke. So the FAST test is a community's test where you can recognize people around you. If they're having these symptoms, they should be rushed to the hospital at the earliest.
Wow, I mean, it's. I believe, like you mentioned, it's been there for like so many years. But
right.
Unfortunately, the amount of knowledge or PR that perhaps this thing should have had has not been there. So we are very glad that we are talking about it in the very first place. You mentioned about certain signs, right, which an individual can understand. What do you think could be the reason where people kind of have not had an idea regarding this? And in today's time, utilizing different mediums of maybe social media, internet, as an expert doctor like you yourself, what are the things that perhaps you are currently doing to, spread that awareness and knowledge amongst the masses?
See, the major thing people know about it,
Right.
but sometimes, it recovers. The body is very intelligent. It gives you warning signals. So people maybe not be able to speak for some time and they know something is wrong, but it recovers. So they sit on it. There may be some weakness. Again, they say, chalta hai, ठीक हो गया. They can go ahead with it. So this is a common thing I find in people that ignore the symptoms. It's not that they're not aware now. There's a lot of awareness programs going on and people have some idea about it. But still they ignore the symptoms. So once it becomes very big, once it becomes a major stroke, then they rush to the hospital. So that is the reason from a simple pill of a blood thinner, where it can be prevented, it cannot become bad to the patient, it becomes a major stroke where they require procedures.
So, ma'am, are you saying in a way that an individual can possibly have stroke without knowing that he or she actually has a stroke? Is that possible?
It is possible. In the sense, if some patients present with loss of consciousness, they may be into deep coma. So somebody around has to assess them and know that this is not normal.
Right.
Take them to the hospital. There are people that the common Indian thing which I see is कि हाथ कमजोर हो गया, बोलने में दिक्कत आ रही थी. It may be stress, it may be hard work, they sleep on it. 8-10 घंटे के बाद वो उठते हैं, फिर वो hospital आते हैं when it becomes bad. So this is a common thing. We underestimate the minor symptoms. Once it becomes big, it's a common human error also, we ignore the first symptom. But again, then we say, we should take action on it. So they ignore the first symptom, they sleep on it. And by the time they come to the hospital, the window period even for the treatment is lost. So that's the time, then you are depending on the rehabilitation measures and the other treatment to bring them back to the routine.
Absolutely. Ma'am, with all your wealth and pool of experience that you have had over the period of time, how long do you think it takes for a stroke to go from, I would say, low to moderate to very, very high?
Okay, so it depends on the severity of the stroke. And it takes 6 minutes for the brain cells to die. So when the person is having a stroke, the person is losing around 2 million neurons every minute. And that is the reason we say rush to the hospital immediately. Underestimate the initial symptoms. It may be a matter of minutes where in rapid progresses, they can progress very fast. Or in some patients, it may be a matter of few hours where they can become bad. So it depends on the severity of the stroke and the level of occlusion or the loss of blood supply to that area of the brain.
Ma'am, any specific case that you have personally handled which you kind of remember where there was very early detection of stroke and the individual who suffered from it acted very early, and because of that swift action, he or she is living a comfortable life? Because as Indians, we tend to look at examples, right? So if somebody has a successful example in front of them, then they feel like, oh no, we need to act on it as well. So can you remember any such instance of
So it's a routine thing. Yeah. Last week, we had a 20-year-old boy.
Okay.
Who had come with paralysis. So the family brought him to the hospital within half an hour. So since there was a large vessel occlusion, it was a major stroke, we had to take him for a cath lab procedure and do a mechanical thrombectomy. And post-procedure, the person was able to lift his hand. And it's gratifying, it's so much of fun seeing this when the patients recover. So if they recognize it early, we can do the investigations early, because even the hospital requires certain interval of time.
Right.
To do the investigations, decide the line of treatment and treat them accordingly. So once they come early to us, the recovery is very fast. And if they are delayed, and obviously all these revascularization therapies are dependent on the first few hours of the window period, and only in a limited patients we can give it in a delayed window period. So if they come early, we are able to reverse the stroke. Otherwise, then we are depending on the physiotherapy and rehab for the recovery of the stroke, for the, whatever is the surrounding brain tissue or the salvageable brain tissue is there, which can function and take over the function.
Right.
And the bad example I'll give you of your brother. So he has risk factors. He's hypertensive. He goes to work. He gets double vision, which lasts for a few minutes, and it recovers. So he continues to work after that. And evening when I meet him at 8 o'clock, he comes, ki aisa hua sham ko. So this is what I'm trying to tell you, that even people who know it, because it recovers, they underestimate ki theek ho gaya, we'll see it later. Until, in the night when he came, we rushed him to the hospital and we treated him and started treatment. If we don't take action, it is possible that he would have missed the symptoms, and 2 days later he would have come with a major symptom of it.
And you mentioned the case of the 20-year-old boy. So I'm picking that keyword, ladies and gentlemen, 20-year-old. So the biggest myth, I believe, that a lot of people have had over a period of time, oh, nothing is going to happen to us till a certain age, this, that, etc. Here we are talking about a 20-year-old guy who's been there in the world for like just 20 years. So it can literally happen to anyone and everyone. Ma'am, my next question is, do you think in the last 20 years or 30 years, maybe the number of cases of strokes have increased due to certain lifestyle changes that individuals have had? It can be because of exposure to pollution or anything which is not really helping the internal system of the body. Do you think these have also been a contributing factor for that?
See, definitely it's a lifestyle disease. The major risk factors for stroke are what? If you have a healthy lifestyle, 90% of strokes can be prevented. And it's a big number. If the patient, now India is a capital for diabetes.
Yes.
Because of our food habits. Smoking is a very risk factor. Again, in young, it's a very important risk factor for stroke. High cholesterol. The more of junk food and processed food, and we are not realizing what we are eating. High cholesterol is a very high risk factor. Sedentary lifestyle. The more we are indoors and gadget dependent, we are cutting down on our physical activity. We all know that.
Right.
Hypertension. Hypertension goes unrecognized because if we don't regularly check our BPs, we don't know we are hypertensive or not, unless until it causes a target organ damage. So hypertension, diabetes, high cholesterol, obesity, smoking, high processed food with high salt, all are very important risk factors, and these are increasing in our lifestyle itself. We see that it's more and more of this we are seeing because of our lifestyle habits. And definitely the incidence of stroke is increasing. Countries who have been careful about it, they are seeing a slight decline in the stroke risk in their population. So what it was a couple of years back where nobody was health conscious, we see a slight change. Even at
There is a shift in
people's mind that they want to have a healthy lifestyle, they want to exercise, they're careful when they're eating something from outside, how many calories are there. Correct. So this is having an impact, and in long term we will see a decrease in stroke if people are careful about it.
I think very, very important, and it should work in that direction. We talked about myths, which is one of the myths everybody is aware of, is that it's not just about old people or after you have hit a certain age. What are the other myths which are possibly around stroke, which really, really need to be cleared immediately?
See, the myth about the stroke is that one, it's not preventable. So if we control the risk factors, stroke may not occur. The second thing is, if you have missed the first window period, nothing can happen. So these people are very depressed. They shouldn't be depressed because still there are a lot of other methods which we try to work on and bring them out. Third, as we have already spoken about, the minor stroke or the TIAs, that the symptoms have occurred and they forget about it. So these are the 3-4 things people should be careful and manage in their lifestyle. It is an awareness thing that people should know that stroke is treatable, stroke is preventable, and we should work towards it.
So if any individual is currently aware of the fact that he or she has a stroke, and he or she is perhaps simultaneously getting treated as well in terms of medication, etc. and all, can he or she be completely free from stroke, or will some of the other underlying symptom will always be there throughout his or her entire lifetime?
It depends on the severity. As we said earlier, they are minor, moderate, and the severe strokes. If they are minor strokes, with the simple blood thinners, these patients do well. They need blood thinners for life. Don't stop medications because it doesn't spare. And they do well in their life. The moderate and the severe strokes may have some deficits left to them depending on how they were treated. As we talked about the revascularization therapies, they are possible in the first half of the or the early window period of the stroke symptoms. If we are able to reverse the cause, these patients do much better and can come to the mainstream of life. But if we miss that window period, some of these patients can have very severe deficits in terms of they may be bedbound. I mean, it leads to paralysis of one half of the body. They may not be able to walk without help. They may require tube feeding. There may be difficulty in vision, so you can't drive. So there are multiple things depending on the severity of the stroke. That means the area of brain injury and how they were treated.
Yes, ma'am. Ma'am, we have something called World Stroke Day, and I'm sure it's been an integral part of your life for the longest time. Could you please tell us more about that particular day so that people also from our country are aware what are the things that they should perhaps focus on specifically on that day? I mean, ideally throughout the entire year, but specifically on that day, what are the things that they should focus on?
See, World Stroke Day, we work for the awareness programs. It's good for the medical community because they take time out and focus for this day and month that, we can make people aware about the stroke treatments, the stroke symptoms, and how they can be prevented. So a lot of community programs are focused on stroke, not on the other disease in this month to help people at large to prevent and treat strokes. So I think it's a very important program for the community, and even as a medical community, we know that all the doctors will try to focus on it.
Yeah. Of course, we know about the maximum hazards that are possible. Like, I believe out of 4 adults, there's some statistic which says that out of 4 adults, every 1 adult has a chance of getting stroke, right? So that's a fairly scary number, so to say. What are the possible risk factors and hazards apart from death, which perhaps is the ultimate thing? What are the other ways an individual can suffer apart from paralysis? Because we ideally know of paralysis or death, right? What are the other ways in which an individual can suffer throughout his or her entire life if, again, not treated within the right window and not having the expert medical guidance that he or she should have?
Okay, so they may have difficulty in talking, as we said, that the speech may not be clear. Suppose somebody is an orator. It's a life for them. Yeah. Somebody is a writer. If you cannot perform the skill movement of writing, maybe an athlete cannot run. So in an individual case, these things become very important. A driver for which the vision is very important.
Very important, right?
Other than this, some may have memory loss, which we call it a post-stroke dementia. Especially in elderly, we see this, where the memory is impaired, so they don't remember things. And secondary to all this, the depression. Today you are normal, it comes suddenly, it attacks suddenly. Tomorrow you are dependent for your daily activities, for going to the bathroom or eating. It's very difficult. So these patients, especially and the recovery takes quite some time. It's a matter of months where they recover. So they are very depressed. So they need a lot of motivational support and family support and emotional support to come out of that phase, or at least to fight the disease.
Ma'am, could you kindly tell us a bit about the emergency treatments that are, possibly available for AIS? Because, like I said, that not everybody will be approaching the hospital for medical services in the initial window, right? A lot of people will unfortunately be aware about it at the very last moment. So what are the emergency treatment options that are available right now?
I think it's the best question we can have it so far, because this is where you can reverse the stroke. So that's the reason we say that treatment is time sensitive. Come to the hospital early. Once you come to the hospital early, in the first 4.5 hours, we can give the intravenous thrombolysis or the clot busting drug, which opens the clot. See, the disease is a blockage or occlusion of a blood vessel.
Correct.
The aim of the treatment is to restore blood flow to the brain. So the first treatment is the intravenous thrombolysis or the clot busting in the first 4.5 hours. You cannot give this drug beyond this window. So you have to be early to the hospital. The other treatment is the thrombectomy or the mechanical thrombectomy. This procedure is done when the patients have major stroke. That means one half of the brain is at risk. So where the major vessel of the brain is occluded, we take these patients into the cath lab. We do angiographies of the brain as they are angiographies of the heart. We put tiny stroke devices to which are called stent retrievers and the aspiration device, where we entangle the clot and pull the clot out of the system and again revascularize the brain. And this is a very effective treatment. The other importance of this treatment is that this can be done in a delayed window also, in a select number of patients up to 24 hours.
Okay. I think that's a very, very pertinent point. At least it gives hope to a lot of people who have perhaps realized it late. That better late than never. That's what it is. India is a country which is pretty diverse. It has got multiple options for everything, right? So even with hospitals, you have got like 50, 100 options. You just type best hospital name and so many things come, right? For specifically stroke treatment, how does an individual with very limited medical knowledge identify that this is the place I need to go and get my treatment done, or this is a place where I should perhaps not get my treatment done? How does an individual identify that, ma'am?
Okay, so one thing should be there, that all patients should go to an equipped hospital, which we call it a stroke equipped hospital.
Right.
Now, it entails that there should be an emergency services for 24/7. It should be equipped with a CT scan and an MRI machine. They should have a DSA cath lab. They should have a good ICU backup, followed by a neuro-rehabilitation therapies or departments. All these are very important for a good outcome for a stroke patient. The major mistake people do is they go to an OPD of their doctor. So that means they waste time if they are having minor symptoms. Second mistake they do is they go to a small setup which is not equipped. Because transferring from a small setup to a major setup takes a lot of time.
Of course.
And you lose the window period. So important, and this requires a government policy. I mean, I think it should come as a government policy that they can recognize stroke-ready hospitals, and all patients with acute stroke should go to these hospitals only, both in the public sector and the private sector. So if they are labeled as that this is a stroke-equipped hospital, people will know where they have to go.
Do you think this has also been one of the biggest reasons why perhaps the number of recoveries that we would have ideally wanted that have not happened? Because people have gone, because of lack of knowledge, they have gone literally anywhere and everywhere. They've wasted time. They've wasted a lot of time. You know, I would say it's a price sensitive country, right? A lot of people perhaps waste their money, and then later when they actually have the correct option, perhaps they don't have the money for further treatment. Do you think this has also been a big reason why, the boom in the number of cases?
This is also another reason, I would say, where they go to a smaller setup. And the time they come to us, the window period is gone. That is something which we notice, that we need a government policy for this to recognize stroke-ready hospitals. See, it's not just money. They can go to a public setup also. But if it is stroke-ready, they will focus on it. They have to focus on it. And if it is a private sector also, I mean, most of the private sectors which are stroke-ready are fully equipped to handle it. So it has to come as a policy from the government. What is happening in India is because everybody is treating everything. And people can go anywhere.
Right.
If I need something, I have got it at multiple levels, I can go. And maybe I'm aware of something, so I'll know for what I should go, or to which hospital. People don't know about it. So it has to come as a government policy. And I feel the government should get into it and recognize and label stroke-ready hospitals, because it's going to do a lot of service to people.
Absolutely. We mentioned about identifying stroke symptoms, but any other way, like of course we can get tests done as well, like you mentioned in the very beginning. But is there any other way where an individual, again, like a layman, identify or diagnose a stroke? Is there any other way, ma'am, apart from the tests?
See, FAST is a very good test which we spoke early, because if these symptoms are there, and a person can have a stroke, now no medication can be done or given without the imaging. So neuroimaging is very important. So that's the reason we say it's a clinical examination by a doctor who confirms a stroke, followed by a neuroimaging, which may be a CT or an MRI, depending on the hospital which is equipped with it. And then the treatment accordingly is given. So even if anybody here knows that the person is having symptoms of it, the first thing you have to do is to go to an equipped hospital.
what is the most, I would come to your, career right now. What is the most challenging or the most, I would say, difficult case of stroke that you handled in your career, ma'am?
Okay. So when we see 90 plus patients, we know that how will they take on the disease and the treatment plan. So this is, again, we have an aging population. We are seeing a lot of patients who are 90 plus who are coming to us. So when we thrombolize them or give them a clot busting drug, the risk of benefit ratio, we have to be very careful. And when they recover, it was few months back when a 95, when they she walked up to our clinic, and it was amazing to see her walking on her own and managing herself on her own. So that was something when she was in the hospital, when she came to the emergency, we had to give them the pros and cons for all these treatment modalities because everything carries a con side to it. And most patients, most people are very reluctant because they think is age pe kya karne ka. Itna old age mein we don't want to do anything. And the family took a call, and she is beautiful. She's back to her. She works as a housework in certain places, and she said, I can go back to work from next week. And I said, yes. So that was something was very, very nice. A couple of weeks which happened with us.
I'm sure it felt like a personal victory to you as well, right?
Out of all the treatment which I do, I think stroke treatment is the most gratifying treatment because it's amazing when your patients who are paralyzed and post-treatment, they can just walk and do their jobs. It may not matter a lot to a patient on the other side because they don't understand the spectrum of the disease. But here when we are sitting there, okay, this guy has done well, wow.
It's almost like you've given that other person a new life altogether. That's how I think
the whole
we look at it.
Cath lab team is in a glee. There's a midnight because these are emergency. They come at any hour of the day, and you can see the whole Cath lab team, right from the peon to our technician, all smiling when we can open the artery and the patient is doing well. It's amazing.
Ma'am, we spoke about stress, we spoke about hypertension. It is something that can happen to any individual, right? It can also be a doctor, it can be anyone, right? As a working independent individual who has been working for so many years, I would say serving the country, because it's a very noble profession, right? How do you yourself kind of de-stress, because the kind of cases I'm sure which you handle, they must be full of stress, right? So how do you yourself kind of keep your calm and composure throughout, where that, okay, fine, I have a very, a job which is of responsibility and accountability, but you still manage to keep yourself calm and cool throughout the entire, I would say, day, because it's a very high pressure job.
Yes, it is. Definitely we take out that 1 hour in the morning or 45 minutes in the morning for ourselves. I do my yoga exercises. I do my Brahma Vidya exercises very regularly. I try not to miss them because that is something, it's a lot of anchor. It trains me for the day. And I'm really thankful for them to training me that. And it was a very selfish move from my side. I did it during my COVID time because when I was put up for COVID duties, I knew that I was neither physically fit or mentally able to take on the thing when I had to see 100 patients. So one of my teachers had trained me into this exercises extensively throughout that. And I realized that not it just protected, it gave me a physical health, but it helped me mentally a lot. That was the time I realized its importance, and I'm continuing since then. And it is very, very important to do something, whoever is doing what, to keep your brains in order and keep your calm mind.
Do you think the kind of profession that you have chosen for yourself, the kind of responsibilities that you have, it is also one of the biggest reasons why you have a very strong mindset and mental, I would say, capabilities? Because you never really know your true potential until unless you're pushed to the wall, right? And I'm sure in your entire career, you have been pushed to the wall many times in terms of handling various cases. So has that also kind of enhanced your own, I would say, mental quotient in order to deal with difficult things in life? It can be personal, professional, everything.
Right. I personally feel people who are in medical profession, most of them are mentally strong. So when I hear about these suicides and things, I am pretty amazed because you see death from day one. You see, it's not easy.
Right.
So when you are a first year student or a second year student in medical line, it is very stressful, and you're going through that phase of life. But then you see life very closely. So most medical students, I feel, are very mentally strong compared to when we see our patients and when we deal with them. So I have a feeling that because you see life so closely, right from the medical training itself makes you mentally very strong.
When young doctors who have just started their careers in the same field as yours, they meet you and they greet you, and they come up to you maybe for maybe guidance, expert advice and suggestion, what are the things that as a seasoned doctor yourself you tell them that these are the things that you really need to kind of cater to and focus on in order to be very, very good at your service?
See, medical line is a very dedicated job, and you have to be very passionate about it. There are no timelines. It's not 8 to 5 or 9 to 5 job.
Absolutely, very important.
You cannot say that 5 o'clock my job is over and I can leave the hospital and go. So you have to be passionate about your job, that you can work for it, because at the other end, there is a life which counts. So you have to be careful. You cannot do it mechanically. You cannot do it clerically, which is what I'm noticing a lot. That there's a lot of mechanical and clerical work. You have to be very passionate and empathetic towards your patient. Then only you can serve them. I mean, it is like you have to do your best. And rest, obviously, you have to leave it to the best outcome every time is not in your hands, but you have to do your best.
We spoke earlier about lifestyle changes and, how things can actually get better. Say maybe this podcast is currently being listened by someone who's very frequently eating junk food, maybe out of compulsion, maybe he or she is not living in the same city like his or her family. Zabardasti bahar ka khana pad raha hai. So there's a sense of panic that's perhaps getting created in their mind as well, right? What are the immediate lifestyle changes that one can bring if all the things that you mentioned somebody is doing immediately in order to ensure ki whatever perhaps damage that has already happened to the body which you're not aware of, that can be reversed?
We can be careful of what we are eating. I mean, even if we are eating from outside, we know what we are eating. Munching is the biggest thing when we are watching television or Netflix. That is the biggest culprit, I feel, because that's the time we don't realize how much we eat and what we are eating. So you have to be careful about every time you put something into your mouth, you should know what you are doing. Whatever has happened, we cannot do much about it. But if you're smoking, quit smoking. And if you can exercise on a regular basis, it's good. At least 3 times a week, you should exercise for sure.
Anybody perhaps who's dealing with stroke or is in the phase of medication or seeking expert medical advice, he or she is dealing with that, right? It can to an extent affect the mental health as well. So do you feel that patients who are dealing with stroke should also, if possible, seek psychological and counseling help as well in order to get their mental health in the right place at the same time?
You're talking about the caregivers.
Yeah.
I think the maximum burden is on the caregiver, especially when the patients are dependent. Because they themselves are angry. All their anger and frustration is on the caregiver. So they have a very tough time. At the same time, these caregivers are giving 24/7 care to them. So you please take help. Take help for people. Divide job among yourself. Some of them, these patients who are dependent, specifically who are bed-bound or wheelchair-bound, they require everything to be done, right from cleaning to bathing to feeding. So take help for your family or nursing help or caretakers help to do it, so you can give emotional time to them. You can give quality time to them. Otherwise, you are caught doing 24/7 these jobs. At the same time, the person who needs a lot of motivation, the other person on the other side who's got a stroke needs a lot of emotional help. You are not able to do it because you yourself is
dealing with all the stress.
You yourself is burnt out.
That's the word, burnt out.
I mean, 24/7, like in the night you're changing diapers, in the morning you are cleaning them. It is not easy. So you please take help, divide work among your family members, and don't feel guilty that you are taking time for yourselves. What they do is They feel guilty that, okay, I've gone out for something and my person is at home. But you will be able to do better job service to them if you give yourself some time and you are happy, so you can, give happiness around.
Ma'am, it's been a superb, insightful session so far. But then, I would want to still tap into another important question, which again our viewers must be aware of. We talk about rehabilitation, right? How are stroke recovery and rehabilitation intertwined, and what is the role of rehabilitation in terms of stroke recovery?
Okay, so neurorehabilitation, which includes physiotherapy, speech therapy, occupational therapy, is the integral part of stroke management.
Right.
All patients of stroke require rehab. The duration may differ. It may be few days to few months or maybe lifelong. So every patient, when the patient is admitted, from the day 2 of the onset of symptoms, we involve a physiotherapist and a speech therapist according to the requirement of the patients.
Right.
Because these patients, the physiotherapy is dependent on the fact that on the neuroplasticity of the brain, that the surrounding areas of the brain can take over the function of it. And the aim of the treatment is to bring them back to their previous level of functioning. So we have a lot of physiotherapy centers. We start from the ICU, then we see if they can be going to the physiotherapy department where they have multiple gadgets to make them walk, make them stand, and get back to the routine of life.
Okay.
Even another one thing I want them, that the physiotherapy is not to be stopped. The aim of the physiotherapist is to train you in these exercises, and you're supposed to do these exercises for long-term basis till you require them.
Absolutely. It's not about the timeline by when I need to finish it. If you're supposed to do it, you have to do it. That's what it is. Ma'am, it's been a supremely fascinating conversation. We have talked about various factors relating to stroke, and I'm sure it's going to be full of insights and knowledge for the audience. Before we close in, one departing message for the audience in terms of stroke and whatever you would like to tell them, utilizing all your wealth of experience.
Okay, so stroke is a deadly disease. It attacks suddenly. But in 90% of strokes are preventable if you have a healthy lifestyle. Control sugars, controls BP, control cholesterol, exercise daily, quit smoking, and the chances of having a stroke are next to nil. Thank you.
Superb stuff. Thank you so much. And, it's all about will. It's all about mindset, ladies and gentlemen. And where there's a will, there's a way. It's a very old saying. So if you actually decide and dedicate yourself towards stopping something like a stroke or ensuring that it doesn't ever happen to you or your near and dear ones, these are the things that perhaps you need to follow dedicatedly in order to ensure that you are not one of the vulnerable cases who's dealing with that. Thank you so much. We have had ma'am for this conversation, and if you're ready for all this, please ensure कि stroke जो है उस पे लगे रोक, stroke पे रोक हम लोग लगाएंगे, and these are the things and these are the ways by which you can also put stroke पे रोक in your life. Thank you so much, ma'am. It's been a pleasure, and we'll see you very soon with another interesting conversation. Thank you so much, everybody. Thank you. God bless. Stay safe, and thank you.